Hello, my name is Dr. Philip Zachariah. I'm one of the pediatric infectious diseases doctors here at Columbia University, an assistant professor of pediatrics, and the hospital epidemiologist at NewYork-Presbyterian Morgan Stanley Children's Hospital. What we have seen is that children have less severe disease than adults. And even if children are as likely to be infected with the virus in the community, far fewer of them come to the emergency room or get hospitalized with severe disease. The majority of children who have been admitted with severe lung disease have had some form of pre-existing medical condition. And these have included obesity, asthma, sickle cell disease, some form of chronic lung issues, or cancer or other immunocompromising conditions. Most of these children have improved during the hospitalization and have done well. The outcomes, particularly in infants and those children with issues with their immune system, have been good. The management of COVID-19 relies on three broad avenues of care. One of them is excellent supportive care, oxygen, fluids, and very good intensive care if you need it. The second is antiviral therapy. We do now have available remdesivir through a clinical trial for children 12 years and above. The final modality is the use of targeted medications to moderate the immune system, to decrease the hyperinflammation that is seen in some of these patients, and these drugs can include steroids. Preventing transmission of COVID-19 to children, and especially those children and most at risk of severe disease, has two aspects to it. One is preventing spread from the community, and the second is preventing spread from the healthcare system. To prevent spread from the community, the major factor is to know the local rate of transmission in your local region or city. And the Department of Health can be an excellent resource for this information. You do need to follow local guidelines around social distancing and the wearing of masks. You have to follow, regardless of risk of severe disease, basic infection control precautions, including hand hygiene and cough etiquette. If there are sick family members around the household, they do need to get tested and follow reasonable household self-quarantine precautions. Preventing transmission in the healthcare facilities is another area which many of us are working to facilitate. Your safety and the safety of the children who come to our facility is our highest priority, and we have instituted multiple measures to reduce risk. These include universal masking and screening of all patients at admission. We are now screening and testing many healthcare workers, both testing for the virus and for antibodies to the virus. And so make sure you talk to your provider or read the information they have provided you about the measures they are taking to prevent COVID-19 in the healthcare system.